Here we will discuss whether the breastfeeding is adequate for the baby. Newborn doctors often get asked this question by mothers, that whether their breastfeeding is adequate for her baby. Now, is my breastfeeding adequate for my baby? That is the topic. Now, here in this video, we will learn how to assess whether the breast milk is alone sufficient for the baby's growth. Now, here we will ensure that the baby gets sufficient milk by exclusive breastfeeding, because in the first 6 months, the mother should give exclusive breastfeeding to the baby. That means the baby cannot be fed any water, fluid, juice, or any other food other than the mother's milk. This is because the baby's immunity is very low. So if you feed the baby anything else other than the mother's milk, the baby can get sick and there is a real chance of death. So it's important to exclusively breastfeed the baby during the first 6 months. So how will you know whether the breast milk is adequate? Breastfeeding is considered adequate if the baby goes to sleep for at least 1.5 to 2 hours to 3 hours after each feed. If the baby passes urine at least 6 to 8 times in 24 hours after the first 2 days. See, during the first 2 days, the baby may not pass much urine, but after 2 days, the baby should pass at least 6 to 8 times in 24 hours. And if the baby gains at least 20 to 30 grams of weight every day. And finally, if the baby's weight crosses the birth weight by the 14th day or second week, then you can consider that the milk is sufficient for the baby. So these are the various parameters. As I've already told you, sleep is important. The urine output is important. The stool is not that important. And you should see whether the baby looks dehydrated or not. If the baby is dehydrated, the baby will have sunken eyes. The skin will be dry and parched. And the weight should not be lost more than 10% of birth weight. In term baby, that means in a 3 kilo baby, the weight loss should not be more than 300 grams. But for preterm baby, the weight loss may be up to 15% of birth weight. And the number of feeds in 24 hours should be at least 8 to 12 times. So a newborn baby gets at least 8 to 12 times every 1.5 hours to 2 hours to 3 hours feed. And during feeding, the baby, usually if the baby is getting sufficient milk, will be calm and relaxed. Will be initially sucking rapidly and then slowly sucks with pauses and soft swallowing. And such babies with adequate milk supply will be feeding for 5 to 40 minutes at most with each feed. Let's go spontaneously, or does so when the breast is gently lifted. And they sleep off and they are content after most feeds. So in the mother's case, you have to see whether how good the mother-infant interaction is during feeding, and whether the milk is dripping from the contralateral breast. That means the milk will drip. If the milk is sufficient, the milk will drip from the opposite side breast. If the mother is feeding from the right side breast, then the milk will drip from the left side. Or if the mother is feeding the baby from the left breast, then the milk will drip from the right side breast. And in the baby side, you have to see if the baby is satisfied or adequately sleeping after feeding. And the feeding should be on demand. That means the mother is not waiting for at least 2 to 3 hours to feed the next time, or the mother is not waiting for the baby to cry for feeding. Rather, the mother feeds the baby as soon as the baby shows signs of hunger. What is the signs of hunger? The baby turns the head and searches for breast and tries to lick. And you have to see how much time the baby is passing urine. The baby should pass at least 6 times, more than 6 times a day. And you should check the weight of the baby. The weight should increase by 20 to 30 grams every day after the first week, and the breast milk sodium concentration should be less than 160 milligrams per liter, which we usually do not do just for theoretical purpose. It is said here. Then how will we know that the baby is ready to feed? So these are the signs that shows that baby is ready to feed, baby is hungry. The baby opens the eyes, seeks for breast, turns the head to sideways in search of breast feed, then protrudes the tongue forward and downward and opens the mouth widely and licks, and the saliva drips from the mouth of the baby. So these are the signs of hunger. There are early signs, and there are mid signs, that is, there shows that the baby is really hungry, and thirdly, there are late cues, which shows that you have to calm the baby before feeding the baby. So the mother has to feed the baby as soon as the baby shows early signs of hunger, like stirring the head around and opening the mouth, turning the head and seeking on rooting for breast. Then there are mid cues like stretching, increasing physical movement, and taking the hand towards the mouth. And then there are late signs of hunger like crying, agitated body movement, and color turning red. And you should not wait till the baby cries, and the mother should feed as soon as the baby shows early signs of hunger. So how much milk does a newborn baby need? First day, one day, the baby needs just 7 ml. That is because the stomach is just the size of a cherry. By around third week, the stomach will reach a size of a walnut and will accommodate up to 30 ml of milk. By the first week, the baby's stomach size will reach that of a volume of apricot and will accommodate up to 60 ml of milk. By the first month, the baby's stomach will be the size of a large egg and may accommodate up to 150 ml of milk. So how frequently should the mother feed the baby? The baby should be fed as per the demand. That means as soon as the baby shows signs of early hunger, that means turns the head and licks, the mother should feed the baby. And usually this time, the time interval is around 1.5 hours to 3 hours between each feed. And the mother should feed at least 8 to 12 times in 24 hours. The mother should not skip night feed. Night feed is important because the milk secreting hormone or prolactin is produced in the mother's body at the time of night, and the baby usually wakes up at night during the first 3 months. So the baby should be fed for at least 4 to 5 times during the night. That means around between 7 p.m. in the evening to 7 a.m. in the morning, the baby should be fed at least 4 to 5 times. And occasionally, baby may sleep up to 3 to 4 hours after a good feed. If the baby is less than 2.5 kilo, low weight baby, then there is a risk of hypoglycemia, in which case the mother has to feed the baby more frequently at a shorter interval, less than 1.5 hours interval. But usually it is when the baby shows signs of hunger. For a successful lactation, you need a willing, motivated mother, active and sucking newborn, free of any illness, a motivator like a health professional or a relative who brings the mother and baby together, and a dedicated relatives, hospital staff, especially nurses and lactation counselors, and initiatives taken by baby-friendly hospitals like exclusive breastfeeding policy and early rooming in. Supportive supervision is also important. On day one, the nurses should supervise whether the mother is feeding and verify how good is the feeding position and is the attachment deep. The baby is sucking the mother's areola deeply, and check if the nipple is too large, too small, or flat or retracted, which can produce difficulty while feeding. During daily rounds, the nurses and doctors should inquire and supervise if the baby is feeding well with a deep suck, and ask the mother whether the mother is having any pain while feeding. And thirdly, Counsel the mothers and relatives regarding the breastfeeding benefits of breastfeeding, support and give reassurance and encourage as each woman needs it. However, do not compel the mother to breastfeed if she is tired and sick or uninterested soon after birth, as, as labor is very exhausting. And too frequent feeding, that means feeding every hour, is also not good. That means there is some problem. The baby is not getting sufficient milk. Baby should not be repeatedly woken up for feeding. But if the feeding interval goes beyond 3 hours, then you may have to wake the baby. Sometimes the baby can go into a lethargy because of low blood sugars. So the take-home message regarding this presentation is that the indicators of adequate breastfeeding in the mother is that the baby sleeps for at least 1.5 hours to 2 to 3 hours after each feed. The mother is feeding at least 8 to 10 times in 24 hours. The baby passes 6 to 8 times urine in a day, and baby regains birth weight by around 14th day by around 2 weeks. Family has an important role in establishing successful breastfeeding, and the mother has to breastfeed the baby exclusively for the first 6 months. Thank you for your patient listening.